بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. اليوم راح نبدي محاضرتنا موضوعها فانجل ديزيز، الأمراض الفطرية في جلد الإنسان، وهي من الأمراض الشائعة في جلد الإنسان، وخاصة في فصل الصيف بسبب ارتفاع في درجات الحرارة وكثرة التعرق والتعرض بكثرة للماء. هذه كلها تؤدي إلى زيادة الإصابة بالفطريات الجلدية. Dermatophyte, we have three types of fungal infection. Dermatophyte infection اللي نسميها ringworm, candidiasis and pityriasis versicolor. Fungal infection, we have many terms or synonyms: mycosis or mycotic infections. Type of mycosis أنواع الفطريات اللي هي cutaneous اللي تصيب superficial layer of skin نسميه superficial mycosis or dermatomycosis or dermatophyte infection or ringworm. كلها هذه أسماء لمرض واحد اللي يصيب superficial layer of skin اللي هي stratum corneum. ثانيا عندنا subcutaneous mycosis and systemic and opportunistic mycosis. Fungi grow in two basic forms, يا إما yeast or mold. Yeast usually unicellular, nucleated, non-filamentous, oval or sphericals, while mold are usually multicellular and filamentous. Yeast reproduced by process of budding, while mold by spore formations. Some yeast are opportunistic pathogens، يعني هي موجودة في جسم الإنسان بشكل عادي، لكن بتكون هناك immune compromise or decrease in the immunity. This yeast will be proliferated and became pathogenic and produce clinical manifestations. هاي المولds وهاي السبورز. Dermatophytes are fungi that infect the tissue, contain plenty of keratin. عادة الفنجاي تعيش على الكيراتين أو هو بروتين موجود بالسكين بالهير بالنيلز. إذن على dead layer of skin, not and don't live in the lived layer of skin, usually on the dead layer of skin. وأكثر شيء على الكيراتين digest and lyses the keratin. والكيراتين موجود عندنا بالسكين بالهير بالنيل. Dermatophyte usually restricted to the non-viable tissue and grow at 37 centigrade. More than 37 centigrade don't live, and in the absence of the serum. Some type or species of fungi produce keratinase enzyme, elastase, and other enzymes that lead to the digestion and destruction of keratin. We have three genera of dermatophyte: Trichophyton, Microsporum, and Epidermophyton. Dermatophyte ringworm invade only stratum corneum, and the inflammatory reaction produced as a result of the metabolic product and the enzyme productions, or as a result of delayed hypersensitivity reactions, immune response by the host, they lead to the severe inflammatory reactions. We have two types: يا إما zoophilic transmitted from the animal to human, and usually this is more inflammation and more destructive, while anthropophilic usually from human to human is mild. We have superficial fungal infection divided according to the body site: tinea capitis, bardi, fasciae, corporus, manam, pedis, tinea cruris, and onychomycosis. بشكل عام dermatophytes, superficial dermatophyte characteristic by specific clinical features. Usually these pictures characterized by active border with scaly red and slightly elevated borders, and with small vesicles usually occur on these borders and leave a clear centers. This classical pattern of presentation present in all type except the palm and soles. مثل ما تلاحظون هذه الكلينيكال pictures، هاي border well demarcated، مثل ما very well demarcated, slightly elevated, erythematous, scaly, some vesicles and slightly clear center when expand. tinea pedis اللي تعيش بين أصابع القدم، عادة موجودة عند الرياضيين، عند الناس اللي excessive washings. We have 3 types: Soji interdigital scaling, diffuse dry scaling, and recurrent vesications. This is Soji interdigital scaling. يصيب infect the webs between the toe of the feet. This is powder scaling النوع الثاني. مثل ما تلاحظون powder scaling exaggerated in the skin lining and marking. Third type characterized by vesications, vesicle formation in the border of the soles. This is interdigital scaling. Tinea of the nail, toenail نسميها tinea inguam or onychomycosis, usually associated sometime with tinea pedis. The initial changes occur in the free age of the nail, become yellow, crumbly, with subingual hyperkeratosis and thickening of the nail and destruction of the nail, usually a few nail involvement. مثل ما قلنا الدرماتوفايت have many enzymes, secrete many enzymes, as elastase, keratinase, lead to the destruction and lysis of the keratin of the nail. لكن normal skull surrounding the nail is usually normal, don't infect it, just infect the nail. Like this picture, yellowish destructions of the nail plate. Tinea of the hand, usually asymmetrical and sometimes associated with other type of the infections. Tinea of the hand, as you see, there is a powdery scaling, white in color, in the finger and skin line. This is differentiated from the contact dermatitis, from psoriasis, or from the other type of skin disease. This is there is exaggeration of white powder scaling in the skin lines. There's another picture. This active well demarcated borders. Sometimes في بعض الأحيان patient have more one type of the fungal infections, sometimes of the palm, soles, and onychomycosis. مثل ما هذا المريض we have 2 types. This is onychomycosis. Tinea of the groin, we called it tinea cruris. عادة هذه تحدث بطيات جسم الإنسان مثل الأبط أو بين الأرجل، وهذه تكون بسبب ارتفاع درجات الحرارة, sweating, heat, and excessive washing. Usually unilateral, involve the upper inner thigh is usually involved. The lesion expands slowly, sharply demarcated plaque with peripheral scaling. هذا دائما مرات نشتبه ويا الكانديدياسيس. عادة الكانديدياسيس تكون more moist, more inflammatory, associated with satellite macule and sometimes colarity scaling and pustule in candidiasis, and involve the scrotum, while tinea cruris اللي هي superficial dermatophyte don't involve tinea cruris, don't involve scrotum, and usually dry. This picture of tinea cruris مثل ما تلاحظون dry, active border, well demarcated, dry, active border, sometimes descend to the thigh or ascend to the abdomen. While in candidiasis, more moist, more inflammatory, more redness, with satellite pustule مثل ما تلاحظون هاي pustule outside the mother with involvement of scrotum. This is candidiasis. This is satellite pustule, more inflammatory, red and inflamed. This is also candidiasis. Tinea of the trunk, usually more dry مثل ما تلاحظون dry, well demarcated, active borders, slightly scale and a clear center. Tinea of the capitis, most common in children. Fungi come from anthropophilic organisms اللي هي تنتقل from human to human, usually less inflammations, produce a black dot ringworm, while zoophilic transmitted from the animal to human, associated with pouch swelling, inflammation, pustulation, with lymph node enlargement, and if the disease if not treated very well lead to permanent scarring. This is the black dot اللي هو anthropophilic transmitted from the human to human. less inflammations or broken off hair. لذلك الhair when broken off appear as a black dot مثل ما تشوفون بهاي الصورة a black dot broken off hair. while in carrion عادة قلنا transmitted from the animal to human, more inflammations if not treated lead to the loss of the hair permanently. tinea of the beard اللحية اللي هو مثل الكيريون more inflammations and scarring if not treated. النوع الثالث نسميه favus characterized by foul smelling yellowish crust surrounding many scalp hair, also if not treated to the scarring. This is favus, yellowish crustation surrounding the hair with bad odor, also if not treated lead to the scarring. هذا tinea barbi, swelling, inflammations, loss of the hair. أهم شيء عندنا localized area of hair loss with broken off hair and lymph node involvement. هذا carrion. Investigation, microscopic examination or culture would light. Treatment أما topical if the disease localized like mucosal, clotrimazole, or systemic especially if involve large area or immune compromised and on the scalp. We have terbinafines, itraconazole, and crizofulvine. Crizofulvine the first choice in tinea capitis of the scalp. All of the drug, oral, systemic, systemic drug contraindicated in a pregnancy. Just in a pregnancy we use topical and don't use systemic. Thank you very much.